Now we're going to get down to the nitty-gritty of what Indians are all about.
I still say we Indian people are believers in the truth. This is the way of life that was given to your people. You're born an Indian, you're going to die an Indian. Indianness is a good life. You're facing an Indian this afternoon.
Welcome to our program. Thank you for listening in. If you're all at home, we are going to continue our series in coverage of the coronavirus. To discuss that, we have Kristen Carollo from the County Health Department region. She's here to talk about how the county is responding and what kind of things we found out so far about this deadly virus coming our way. Good morning, Kristen.
Good morning.
Thank you for coming in. We appreciate you.
You're very welcome.
First of all, let's introduce yourself. We got the name part down, but what about your title and what's your responsibilities?
So my name's Kristen. I actually work out of Muskogee County Health Department, but the state health department is set up in regions, and I work out of Region 7 whenever it comes to emergency response, and I'm one of the public information officers. I actually usually am a wellness coordinator over in Muskogee County, but for emergency purposes, we do have different job duties, and so mine is doing public information, getting messages out, getting information out, doing a little bit of social media and contacting the public on what is going on and trying to keep them up to date on information.
Well, I've been a PIO myself for the Anchorage Electric Utility. And,
so you know the pressure.
Oh, yeah. And on top of that, we were also assigned to the state firefighting units, too.
Okay.
So that got a little crazy.
Yes.
So I know you've got a lot of bases to cover, and you have to be a jack of all trades and dispensing information that may not be your field into a manageable form for the public.
Yes.
First of all, of course, all the news headlines and things have been filled with stories about the virus and how it's affected us.
Yes.
Now, we wanted to bring it a little closer of course, for our Muskogee Creek citizens, but for the community at large.
Yes.
So I guess we'll start off by wondering what the story is so far. What are the numbers of counties that you cover?
Right now in Region 7, there are 8 counties, and I probably should have wrote those down so I could list those for you, but Adair, Cherokee, Muskogee, Okfuskee, Okmulgee, I believe Haskell, Sequoia, and there's one I'm missing. No, not Tulsa. Tulsa is its own entity. Tulsa City County Health Department and Oklahoma City County Health Department, their own entities because they are so large. They are separate but work with the state health department because of the mass amount of people in those counties.
Well, what you've just described then is pretty much most of the Muskogee Creek Nation.
Yes.
We have 11 counties there.
Yes.
And you're covering most of them, but not necessarily just the creeks. You're looking at the community at large as a whole.
Yes.
We've been seeing the maps showing the numbers slowly rising that talk about the numbers of people who are now infected and having to be quarantined. What kind of numbers can you share with us, first of all?
So in Okmulgee County, there are 4 positive confirmed cases as of this morning. And I actually had a total number, but I have to add it up, and I don't have the ability to add it up right now. But there will be new numbers coming out for a total confirmed cases in Oklahoma. They usually come out around between 11 and 12 o'clock, and that'll get updated. on the website, the coronavirus.health.ok.gov. Again, that is coronavirus.health.ok.gov. It is a great resource for up-to-date numbers, information, resources, what to do if you're sick, information for businesses, how you should handle it if you are have been potentially exposed to someone who is a positive case. And so there's lots of great information on that, and there's phone numbers on there that you can call as well.
Okay. What might be the last numbers that you saw?
On like a total? Well, I know that
Just a ballpark.
I believe it was 5. Let me look right quick and I can tell you, because I believe as a state we had increased by about 100 is what we had. And the last number total was 565, and I believe the new number is about 665. And so, and it will increase. And the thing is that as testing increases, the numbers will start to increase, because we will get more of those positive tests back. Now, the numbers aren't there to scare people. They're there to make people aware of what is going on and make people aware of how much it is in their community. But those numbers are there to make people aware so that you can be taking the precautions. You know, a lot of people are calling in asking questions about, well, what can I do? What can you do? Wash your hands. Don't touch your face. Make sure you're staying at home, especially if you're a vulnerable population, such as our senior citizens or anyone who has an autoimmune disease or asthma or anything like that. You want to make sure that you are staying in, social distancing. If you do have to go out, it's only for the necessary items like grocery shopping, medical purposes, or if you need to go get medicine. Now, you can go out and walk, but they want people to stay home as much as possible.
I think that message is sinking in. I've noticed on the highways and streets, the traffic numbers are down.
Oh, yes.
Much thinner. Now, I guess a critical thing I had to do yesterday was get part of my lawn cut, because it's starting to get a little
It's
crazy.
getting tall already, huh?
Right, and so I had to get a wheel for my mower, and I went to the Lowe's down the road there, and walked in and noticed there were people wearing masks and a few wearing gloves, and a mixed group of employees there. So I took that as a good sign, and even put on my own mask, and I had some gloves, but had dropped them somewhere. So it seems like people are paying attention now. It's not, that darn thing is way over there, it don't affect us. It is. It's here. It's home.
Yes, it is here.
Have you, as your department, been seeing that sort of response from Oklahomans? Are they taking this message really seriously?
Slowly but surely they have. I actually live up in Tulsa County and work in Muskogee County, and there for a little while there wasn't much change, but I drive 45 minutes to an hour to work every day, and I've slowly seen the decrease in traffic and people being out. And I've also seen an increase in cars at home and an increase of cars in driveways and people out and about, like within the addition that I live in. So slowly but surely, and I think too that goes back to the closing of businesses, like the non-essential businesses, and only keeping essential businesses open. And then of course there are some cities, counties, towns that are starting to do shelter in place or stay home, or even as of this morning, Tahlequah was doing a mandatory curfew from 10 p.m. to 5 a.m. And so there's things that are being implemented that are kind of forcing people to social distance and forcing people to stay home and not be out and about, which is what is the healthiest choice right now for a lot of people. That way we can slow the spread of COVID-19.
Have you had any discussion of essential businesses? I mean, obviously, gas and food and those kind of things, but I mean, a lawnmower wheel, it doesn't sound really essential unless you see my yard.
Yeah.
But have you all had any discussions of what should be open and what maybe could be closed for a bit?
As far as essential businesses, that directive comes down from the cities, the city officials, your local officials like your county commissioners, and your state legislators, and your governor or our governor. And so that's actually going to come down from them. As far as the state health department and public health, we are helping with the testing and the regulation and getting that information out as far as how that situation with COVID-19 is going. But as far as defining what is essential, that is left up to the cities and the city officials and our governor.
I think most people understand what's going on. Many stores have voluntarily closed, and you mentioned the small businesses who are going to get hammered.
Yes.
And schools. I mean, wow. I mean, when's the last time we had statewide, closures?
I don't. You know what? I've never seen that.
No.
Never. Except for I think maybe whenever we had, what was it in 2000? Was it 2007? That big huge snowfall, and we were out. They were out for like a week or something. But that's it.
That's Mother Nature reminding you of who's in charge.
Yes, exactly.
The effect we're seeing is going to be monumental, and it's still being measured. Now, what is the discussion among the state officials, or the county officials? What's on the top of their agenda? What do they have to do first?
As far as the county officials, I don't have a lot of information pertaining to that. Each county is meeting on their own and having meetings with the regional directors within the region. And it's different from county to county based on what is currently going on within their area. And it can be different because maybe they don't have any positive tests yet, because there are still a few counties in Oklahoma that haven't shown anything, but it could be because there's a smaller population there, more a rural area, more country, and so people are a lot more spread out. But from what you see on social media, a lot of the representatives are wanting to try to get the information out to the public and get the numbers out to the public to make them aware. Or whenever positive tests started showing up, a lot of people wanted to get to let the community members know that there was a positive case in their county, which is understandable. And a positive case cannot be spoken about until it's confirmed through the state health department. And so we have to wait for that information before we can say, yes, this is what's going on in the county, because what we don't want to do is confirm a case or say we have a positive case in a county and that be untrue and cause a lot of fear and cause people to go into a panic whenever it's not necessary.
Has the region, we'll refer to it as region now rather than county, have they stockpiled the necessary PPE, personal protective equipment, the masks, the respirators, that sort of thing?
I do know that there are available things for the health department employees to use so that if they do need to do a test or if they do need to be around someone who is possibly positive, that they do have what they need on hand. As far as a stockpile, each county is different. In each county, there are some places are, and I don't know if you've seen this on social media, but some places are actually donating from their stock to the health departments and to the hospitals or healthcare providers. And like down in Southwest Oklahoma, there were a couple of schools that they're closed right now, and they said, we don't need this, we're not gonna need this, and so they donated it to an area hospital in Norman. And so there are people that are coming forth and stepping forward to provide equipment for different hospitals and health departments to use. And so that is great, and we do appreciate that.
Well, God bless them all.
Yes.
One of the things we hear about is, I guess, maybe fatigue among our first line responders, the doctors and nurses who have to be there for these incredible hours.
Yes.
How are you dealing with that? Have you got some sort of staggered schedule for this area? We're going to have the people there?
So as far as the health departments go, the health department hours right now are 8 to 5. And of course, we aren't doing anything that causes an increase of people to have extended hours past that. We do have some people, like our lead nurses in each county, or if we have someone that has to go to a late night meeting, we do have some people that are having to stay past 8 or be there before 8 and stay past 5 or 6. And but we do have services available for our employees to access related to if they are needing someone to talk to, if they're needing someone to just vent to. We are putting in place some mental health resources for them to bounce off of. It's exhausting just doing 8 to 5. I can't imagine what it's like to be in the hospitals right now because we aren't in the hospitals and I'm not in the hospitals. But doing 8 to 5, you're working straight 9 to 10 hours unless you're there longer. And the calls are just coming in. The people are wanting information. And so being able to give people what they need or to reassure people, it can be mentally exhausting. And that's why we want people to be mindful of where they're going and what they're doing so we can slow the spread of this and not wear everyone out. Because, if you're a nurse and you're working a 12-hour shift and you just go and go and go and you don't have any breaks, they're going to get worn out. And I don't know how the hospital's handling their staff, but I would think that they would be making sure that their staff are okay. And we're reiterating to our staff, if you need a break, make sure you take a break. If you have a moment that you're just overwhelmed or stressed with everything that's going on, tell your coworker, go take a break outside, go step outside for a moment, because we want to make sure that people don't get burnt out right now, because this isn't stopping tomorrow. This isn't stopping, this weekend. It's something that we've got a few weeks of moving forward with and figuring out how we're going to handle it.
As a PIO, you must know what a 16-hour day is like. So I wouldn't imagine there are a few of our medical people who are seeing that kind of thing.
The days, like, whenever I try to go home I'm a mama, and so whenever I go home, I try to leave work at home. And I guess I got an email late last night with some information, and I waited to get it till this morning, because you do have to separate that time so you have the downtime. But I do know, like, as our first responders, firemen, police officers, EMTs, nurses, our doctors, as they get exposed and get sick, it's going to shorten the amount of staff. And so some of those staff may have to have longer days, may have to work longer shifts or work an extra shift. And so we want to make sure that we're taking care of anyone that is having to do those extra shifts or longer shifts so they don't get worn out. Because if they aren't there to take care of us, we don't have anybody to step in. If our nurses are out and our doctors are out, we need them to be there. We need to take care of them.
Well, I can imagine, though, at the end of the day, people are just absolutely worn out, and that's probably where the mistakes might be made. Mm-hmm. Somebody's too tired to look at something or didn't notice it because they're, yawning or whatever. Mm-hmm. So, I sympathize with them. Mm-hmm. Now, there's been a lot of talk recently about testing.
Yes.
So I guess from your position, we want to know what's the status here? Do we have stations set up for testing? Do we have enough of the tests themselves? What kind of response are we seeing? Are people, still together, or are they getting a little nutsy there?
So as far as testing, they do have on the coronavirus.health.ok.gov website. They do have, and I can tell you specifically if I can get this for you. There are 4 drive-through testing sites, and there is one in Tulsa County. I believe it's Kay County and Pittsburgh County, Tulsa County, and Oklahoma County Health Departments. And so there are requirements for those testing. They are trying to get more testing supplies. They are trying to get more places to test. And it's not the fact that they don't want to, it's the fact that there's a shortage across the United States and across the world for testing supplies. And so there are lots of companies that are working on, the rapid testing, that are working on increasing testing supplies. And so it's just a matter of time before that does come through. Right now in this region, we don't have any specific testing sites that you can drive through and come up to. Just anyone. You do have to meet, if you do have symptoms, they want you to talk to your primary care physician first. There are certain criteria that you have to be able to get tested, and they're trying to limit that to those that need it, just in case it's a high-risk person, and we need to know for sure what they have. And so hopefully soon they will get more testing supplies and be able to ramp up the testing so we know exactly the full extent of the numbers.
So right now it is not a good idea just to pop into your doctor's office or an emergency room and say, I want to get tested, because what you're doing actually is taking away the time and resources from people who might have something else.
Exactly. So you want to make sure that emergency rooms are for emergencies. We still have people out there that might get in a car wreck, might have a fire at their house and they need to go to the emergency room. Or you might have somebody who has a seizure or has a low blood sugar as being a diabetic and they need to be taken to the emergency room. We want to make sure that we don't overcrowd our emergency rooms and we leave those for emergencies. If you do have COVID-19 symptoms and you need medical attention, you can call 911, you can call your hospital, but you want to make sure that you talk to them first. You want to make sure that they know that you have symptoms so that they can take the proper precautions to protect themselves and to protect you. Now, the first line is for you to call your healthcare provider or your primary care physician, whichever you may have, and talk to them first about how they want you to move forward. A lot of people don't understand that it doesn't matter if you get tested for COVID or you don't get tested. The treatment is the same as of right now. They want you to quarantine. They want you to isolate yourself for at least 14 days and monitor your symptoms, monitor your temperature, and make sure that you're doing the hygiene and everything. So whether or not you get tested, the treatment is going to be the same. And I think a lot of people are missing that one piece.
Mm-hmm. And for our Muskogee listeners, Jengo Okosis, wash your hands.
Yes, please wash your hands.
Now, what's the, if you can capsulize the message then you're wanting to put out to the public?
So we want to make sure that people are washing their hands and doing proper hygiene. A lot of people don't understand that washing your hands is at least 20 seconds. When you go to wash your hands, you turn on the water, get soap, warm water, wash your hands for at least 20 seconds, sing happy birthday all the way through, sing your ABCs a couple of times. Then you get a paper towel, turn off that faucet, throw that paper towel away, and then get another paper towel to dry your hands off. And make sure that if you do have to touch something after that, you can use hand sanitizer as well. Make sure that you are not touching your face. Proper hygiene. Cleaning your house. Let me tell you something. I know that you know this. Everyone made a run to the store to get cleaning supplies and everything. So, if you have those cleaning supplies at home, make sure you're cleaning your house on a regular basis. Make sure your kids aren't touching their face. Practice social distancing. That means being at least 6 feet or more away from people. And so a lot of what I've seen up in the Tulsa area is people are congregating within their neighborhoods. You can get out, but what we don't want you to do is congregate in big groups because that defeats the purpose of social distancing. If you are standing several feet away and you're kicking a ball back and forth, that's okay. If you're going on a walk and you're social distancing, that's okay. But if you are, getting a big group of people together, having PE together with a bunch of kids, that could cause a spread of COVID-19. And so we want to just make sure that people are practicing those hygiene and making sure that people stay calm and be aware of what the numbers are, but don't have a panic. That's some of the things that we want to make sure that they're aware of.
One of the things we've seen recently was a news story about these young people going on their spring break and heading for the beaches, and there's thousands of them still. And I think one really stupid guy says, "I don't care. If I get it, I get it. I don't want to miss the partying." Yes. So I'm sure it struck most of the world as being really stupid. And I understand he actually did apologize for it. But this is the sort of thing you want to avoid, right? Mm-hmm. You're not invulnerable if you're a young person.
This does not, it doesn't pick you by age, race, ethnicity, anything like that. A good way to put it, and this is what I've heard, it's not a monster that is coming after you. You have to go get it yourself. So if you are out and about, if you're around a lot of people, you're more likely to get it. It's not something that's going to come find you. And so you want to make sure that staying home, it will be more beneficial for you to stay home, because it's, if you're out and about a lot, you're more likely to come into contact with it. And so, a lot of people did go on spring break. We saw in Louisiana that there was a very fast increase of positive cases down there right after Mardi Gras. And so, those spring breakers and the people who went out a lot during the last month, we're seeing a great increase in the numbers in those states. And there's a reason why.
Right. That's like walking into a punch or something.
Yes.
All right, go ahead and hit me.
Yes.
The resources available now, I'm sure people are going to start looking for.
Yes.
And in the last couple of minutes here, we want to make sure that people know where they can obtain help if they need it, or more importantly, information right now. That's starting at point one. So I know you've mentioned this before, but if you could go back and repeat some of that stuff where people can turn for information.
Yes. So if you're here, anyone in any county that this reaches, you can go to coronavirus.health.ok.gov, and there's lots of great information on there. There's resources up there, and they update that website for that BRRS regularly, usually around 11, 12 o'clock daily. And there's also resources on there about the drive-through testing, and resources for information related to what to do if you're sick. If you're a business, there's even information for myths and facts on there as well. Another resource which is new to Okmulgee County is the Okmulgee County Health Department is one of your first line responders here in Okmulgee County. And so they will have a hotline set up, and the phone number for that is 539-286-4582. And that is going to be a Monday through Friday 8 to 5 number, that if you do have questions concerning COVID-19, that you can call that number and ask questions. If you have concerns, or if you're needing information specifically about where can I get tested, you can call that number, and just be patient with them, because they may get an influx of calls and they may not be able to get right to you. But whenever they have that number set up, you should be able to leave a voicemail if they don't answer right away. But that phone number again is 539-286-4582. And so that's just a great resource locally here, specifically in Okmulgee County.
Right. Christine Cabello, please, thank you so much for making time and coming over here to talk with our listeners and share this information. We'll keep in touch with you as this thing progresses, digresses, if you will, and try and keep our listeners in.
Yes, and our regional director, she actually had to step away last minute. She was actually about on her way here, and she had to end up going into a last minute meeting this morning. So she wanted to wanted me to give her apologies for not being able to make it this morning. So we were both running crazy to try to get here this morning, but we appreciate the opportunity to come speak with you and get information out to the community, and we appreciate giving the positive message out that this will end, and those numbers are made for awareness. So please just make sure that you're staying calm and just be mindful and make sure you are practicing safe behaviors.
Okay. Well, thank you for participating in a little Seat of the Pants radio here this morning.